Welcome everybody to today's webinar on what's new with AGNES Connect. Today I'd like to introduce you to our two presenters. Zach Ninteman, he's our Regional Director of Growth for the Western region, and John Baker, who's our Client Success and Implementation Engineer. And today we're going to go through all of the features and functionalities that are new to AGNES, and some of you are new to the product. Some of you might already be customers or familiar with it, but today, hopefully at the end of the webinar, we will also take questions. So please feel free throughout the webinar to type in your questions into the Q&A section at the bottom, and we'll address as many as we can on the webinar. And if not, of course, after, we will follow up with answers to your questions. And I'll turn it over to Zach. Thank you.
Great. Thanks, Carrie. Yeah, as Carrie mentioned, my name is Zach. I am the Regional Director of Growth working in the West region based in San Diego. And so today what we're going to do is focus on some new features that we've released for AGNES Connect. But before we do that, I'm going to go in just a little bit about AMD Telemedicine, who we are, what we do. We have some new faces on the call to make sure we can just orient ourselves with AMD. And then I'm going to give a little background on AGNES Connect, which is our solution here that we are talking about, that we released the new features for. After that, I will dive into the new features. We'll split them into three buckets. First bucket's going to be our security enhancements. Security is on the minds of most everybody in healthcare, so making sure we can address what we're doing to stay safe and secure. Usability enhancements, what we're doing to make the application easier to use, both on the clinic side and then the provider side as well. And then we're going to lump everything into what we call the rest of the best. So these are going to be the other features that we release that's not really in the security or the usability bucket there. And then we'll throw it over to John, who actually is going to click through some of these enhancements so we can actually see them live. But before we go into that piece, I do want to take a step back and talk about who we are at AMD. AMD Telemedicine is an industry pioneer in telemedicine across the care continuum since 1991. Now, that's a very big sentence that we like to break apart and kind of do in smaller chunks. And the first chunk is since 1991. We've been in business for almost 30 years now. And this is important, especially with the onset of COVID-19. We saw a lot of players come into the space. We are not a venture-backed business that saw an opportunity to throw up an Amazon Chime on an iPhone and call it a telemedicine platform. We've been around the block. We've been here since 1991. We grew up actually in the telemedicine hardware space. And then as technology progressed, we realized that in order to have a true telemedicine scalable platform, we got to go focus on the software side. And that's what we did. The other thing we focus on here is the care continuum. Care and providing care is not just in the four walls of the hospital. And again, I think COVID really showed us that. It's in clinics and rural healthcare settings. It's in the home. It's in schools. It's in corrections. So having a platform that can scale to where care is being delivered, no matter where that is very important. We have over 10,000 customer endpoints in 100 countries. We really focus on the seamless real-time integration of medical devices over a SaaS-based telemedicine platform. So streaming live online, we can look inside someone's ear, we can get an ultrasound, we can hear steth sounds, we can get vitals, and much more. Our client base ranges from small rural clinics to large enterprise health systems, school-based programs, corrections, and everything in between. We have the secure, reliable, and HIPAA-compliant cloud-based solution. Also on the hardware side, we're FDA certified and FDA good manufacturing practice as well. 2021, we won Frost & Sullivan's Best Practice Awards. We're a member of ATA and HIMSS and really active within the telemedicine community. So now I'm going to pause and talk about AGNES Connect a little bit. But before we do that, if I can get my slides to cooperate a little bit, Carrie, we do have a question we want to ask everybody just to make sure we know who is in this webinar so we can really drive the conversation the right way. So Carrie, do you want to pop up that question?
Sure. Okay, you should see the question appear on your screen, and we apologize. There seems to be something going on if you do see a gray box appear on the screen throughout the presentation. To be honest, not sure what that is, but we're working to fix it. So which platform do you currently use for telemedicine consults? AGNES Connect, AGNES Interactive, or neither of these? And the reason we asked that question, as Zach said, is because some people are, of course, customers of ours or users of the product. The AGNES Connect is our current product. AGNES Interactive is another previous version of AGNES. And then, of course, some of you are new to AMD, and so you use neither. So, okay, it's still populating. I'll give it a few more minutes before I show the answers. Okay, looks like most of you have, and still going, hold on. Most of you have answered. Okay, I'm going to share the results. It looks like 61% are users. And again, I'm sorry if you can't see this here, but 61% of you are AGNES Connect users, 4% are AGNES Interactive, and 36% of neither of these. So that will give you a good gauge of your audience and whether they're familiar with the product or not.
Yeah, absolutely. Thank you, Carrie. And thanks to everybody for filling that out. So AGNES Connect is our cloud-based SaaS model telemedicine platform. This is, we have another solution called AGNES Interactive, which some of you are on. And AGNES Interactive is our on-prem platform, which means essentially each instance of the software is on the sending site, on the cart. Whereas the cloud now has the instance, which obviously makes it quicker to deploy. We can push out security updates and brand new features like we're showing now faster than on a on-prem hosting service. So the features that we're going to talk about is from AGNES Connect. And at the end, we'll have all the information from our account reps across the US, so you can reach out to your account rep if you want more information, if you're on AGNES Interactive, or you want more information in general. So what we focus on with AGNES Connect is that virtual encounter management platform for that clinical assessment. So in real time, we can stream a medical device and have the conference call at the same time. So if a nurse is looking inside my ear and my doctor is across the world, they can put the otoscope in my ear, see inside my ear, but also get the video conference face-to-face. So if I went to show pain, we can see that as well throughout the entire encounter. Facility and physician management, making sure we know what carts are located where, what's on the cart, how many minutes have that cart been used, and making sure we can manage the carts as we see fit within our organization. Scalable technology for multiple care modalities. The nice thing about being in the cloud is it's deployable very quick and very easily. And our technology is such that the same platform in a cardiology program is the same platform in a behavioral health, is in the same platform in a school-based pediatrics program. So very scalable to say, we want to use this platform maybe on a distant initiative. We can go out and do that without any per provider or per user fees. It's just for the sending site on the software. And then a simplified workflow. We know that clinicians and nurses and really anybody in healthcare has so many clicks in their life within an EMR or a billing or a scheduling. So we really focus on making sure the workflow is as simple as possible within the platform, just to save us all a few clicks in our life. Scalability is a word that is really thrown out in the healthcare environment. And when we look at scalability from our perspective, it's making sure that a software platform is not modulated. So our clients don't have to worry about buying something for a hospital and then something for an FQHC and then another module for employers. It's the same platform throughout, the same workflow throughout. So whether you're a hospital, an FQHC, a rural clinic, a school, corrections, employers, skilled nursing facilities, or a home-based program, the software is the same throughout this continuum. It's the form factor, it's maybe the devices, and a couple of other small differences, but the software can be used in each of these cases. So now we're going to dive into some of these new features for AGNES Connect. And the first bucket we're going to dive into is security. Now, security really is on the back end, so there's no real images or things to show in a demo, but we do want to discuss it. One of the top things we did is we moved to a browser-based platform instead of an application for both the clinic and the provider side. This is nice because, again, being cloud-based and now browser-based, we can push out security updates automatically versus trying to update an application within a system. We also improved our authorization processes and how we store tokens, which decreases the exposure to data breaches. And then we improve status notifications when we see users within a session. A couple of usability enhancements here. One thing we did is we improved access to our control panel. So we've always had a control panel where an administrator can add users and adjust the settings. And we've done work to really increase the usability of that, where now an admin can see what licenses they have. They can update portals. They can update groups. It's really the keys to the kingdom within the AGNES software. We're always here to help. We really are. We love helping our clients. We put our clients first, but we really want to empower our clients to take control of how they want to use the portal and how they see it fit. And this is something John will walk through in his demo. This is something that I really like seeing. So images now are captured with medical video are displayed in a preview thumbnail within the sessions document. So for those of you that are unfamiliar with AGNES Connect, every image, every data point that we collect, we store it in what we call a sessions document. Prior to this update, all the images from an otoscope or a general imaging cam will come over as just a typical placeholder image, where if you wanted to see it, you had to double click and pop it up. Now the images appear as previews. So now you can look at all the images and say, great, this eardrum is better than that one. Let's send this one downstream to the EMR instead of having to double click. Again, saving a few clicks in our life is always a good thing. And the rest of the best, streaming ultrasounds live now is both on the provider and the clinician side. So we have the power now for either the provider or where the patient's at to start and stop the device and capture the snapshots. One of the benefits and differentiators of AGNES Connect is that bilateral control, which means that whether the provider is across the room, across the city, or across the world, they have the power to control the encounter as they see fit. In the ultrasound case, being able to turn on the footage, take a snapshot as they need. Our stethoscope, for example, the provider can control the volume, what frequencies they want to hear, which really eliminates the Q&A aspect of going back and forth with the clinician and the patient. So exciting for that feature to be released. We did wrap up our integration with point-click care. So now we have a full integration, which is single sign-on patient queries, vitals and medical image capture that we can then send back to the patient. So if you're on point-click care, we'd love to have a conversation on how we can get that integration with our AGNES Connect solution. We improved our HL7 patient queries, how we pull patient information up from an EMR to start the session. And then we've done a lot of work with our activity reporting. So we've improved the activity reporting to where we have the ability to search by facility, by user, by groups. We can look at the number of call minutes, if a call was actually used. So it's a great way to enhance the just what's going on within our portal. And I do believe that is it. Great. So I am going to stop sharing and throw it over. If I can figure out, the webinar is a little bit different than a meeting. Let's see. There we go. John, I believe that is you.
Hey, Zach, thanks for the intro there. My name is John Baker. I'm the Client Success and Implementation Engineer for AMD Global Telemedicine. I've been in telemedicine for about 12 years now, and my responsibilities are to make sure that our clients are happy and help with implementation of new systems. So we wanted to show a couple of things that Zach was talking about. The first thing we want to show is the streaming ultrasound. So I'm going to log into a session and connect with one of my teammates up in the Boston area. He's in a clinic in Chelmsford. So we're going to go to that Chelmsford clinic and we're going to start a session. We also just wanted to show how easy it was to get into a session as a clinician. So here we have our session started. We're going to give Dr. Ken a call. I'm just going to click the button there and we're going to give him a call. And here we're connected to Dr. Ken. Hey, Dr. Ken, how are you today?
Good morning.
So we were wanting to take just a quick ultrasound if we could. I'm going to start the ultrasound session from my side, and then Dr. Ken, if you could just show us a little bit of how that ultrasound works when it live streams and what we can see on the far end. So we've got a USB probe there. Ken's going to take a look at his neck. And as we're taking looks, I'm also going to take a few snapshots so that we can have some images saved within our session as Ken takes a look at different areas of his throat there. All right, can we move it so we can get one more screenshot? All right, there we go. So one of the other new features that Zach was mentioning was that now our thumbnail pictures will have thumbnails, or our pictures will have thumbnails so that you can see the image that was taken, a preview of the image before you click on the image or go to save the image. That's something that had been being asked for quite a while. And that was just one of the other things that we wanted to demonstrate. So we're going to say goodbye to Dr. Ken and look at a few of the other features. Thanks for joining me, Ken. I appreciate it.
All right. Have a great day.
You too. We also wanted to show how we can export our images. So we're going to pick these two because these are the ones that have the thumbnails of what we want to see. And then we're going to export them to a PDF is one way that we can save them. And if we were tied to an EMR, which I think on this system that we are not, we can just hit export to EMR and it would save to the EMR if that integration is available. Otherwise, I've made a session report where I have my images that I selected. They are saved and I can export this PDF report. From here, we're going to log out and we want to take a look at the activity report. So we're going to leave our session in AGNES and we're going to go back to Connect, which is going to bring us back to our main screen where we could pick our clinics. But instead of going into one of the clinics, we're going to go into the administration menu up in the upper left. One of the things we've been talking about is the activity reporting. From here, I can refine search dates to search over time fairly easily. I can show the number of sessions that we've had, the number of video conferences, the number of patients that we've added our patient demographic for. And then it shows the average amount of time that's taking place. So the average duration is duration of a session and a complete session. The average VC duration is for the video conference. So in the 5-minute and 59-second patient session, 1 minute and 44 of that was in video conference in our demo lab. Of course, the numbers are a little different because it is a demo situation. Average patient duration, 17 minutes and 30 seconds. This gives you the opportunity to see the use of your portals. You can bring it up in a summary, you can bring it up in a graph, or you can bring it up in a table session. The table will show a little more information. It will show, if you click on the results, you can see everything that happened within the session itself, timestamps, when people attached, when things were added, when a vital snapshot was saved, etc. From this table feature, we can actually export in a couple of different formats so that you can download the reporting itself. You can filter the reporting so that it shows, you can choose by group, by facility, by participant, etc. So you can say you want to see how much of this has been done by me. How many times have I been in a video conference, and we can see the ones that I have joined. I can search or filter by video conference and see which one shows that I have joined in the specific time frame that have video conference attached. It's pretty important to be able to say that, yes, during this session, we can verify that we did a video conference during the session. So there's a lot of new reporting features that we have, a lot of functionality within these new reports, a lot of things that can be seen, start times, end times, durations, et cetera, and then actual events that happen within the call as the call takes place. So while we were in the admin area here, we wanted to also highlight the control that you have of your AGNES Connect environment and what you can do. Everything happens from this hamburger menu or the admin menu. When you click on it, you have several options. This is where you would come to create users, and we can see all of the users that we have created here. Adding a user is as simple as clicking a button, adding the user information. Your portals are all listed here, where these are all the portals that you have authorized within your organization. So these are patient instances, places where the patient is going to be. So their portals are here. And then from here, I can even edit names. I can edit the groups that they're within, change specific settings, web page timeout, how many users can be logged into a session, even the appearance of the windows when you first log into the system are all available to change right here. The group settings as well, where I can make the different groups. This is where when I log into my portal, I can see different locations for different clinics where I can come in, and it makes it easier to sort geographically, or these groups can be by facility type, whatever you need to do, but it makes the organization much easier. And then there are some organization settings where you can set the organization's settings across everything, where these will be the parent settings. You can go into an individual portal and change what it looks like, and it will override if you change on the portal level, but these will be what will show from an organization level, including your logo, etc. So it's very easy to get into the administration settings, and the administration settings are very easy to use. So you kind of have the keys to your kingdom to customize the look and feel of your AGNES Connect experience as you like. You know, during initial setup, we'll usually get you started with, you know, what you want to look like. We'll go over all of this in training and how to set it up. But once it's been set up, you really have the ability to get in there and control how you would like it to be and how you would like it to look. One of the other things that we wanted to touch on quickly today was the integration with an EMR system. We have a demo setup of our integration with PCC, so that's the one that we're going to take a look at. When I come to the login page to AGNES and I go to that organization, the PCC organization, we're going to see that I come to a point-click-care login instead of the traditional AGNES Connect login. I can sign in with my credentials, continue as the physician, and then I come back to the very familiar AGNES Connect portal page where I can go and click on my portals. I'm going to connect to a session just quickly to show one of the other great features when you are connected to an EMR like PCC. When we come up to patient demographics, instead of having to put in all of the information, we can search for a patient list, or we can put in various information to refine our search results. But this will actually find our patients, and then when we go to push things back to the EMR, it's going to actually push back to those patient records rather than having to save to a PDF or download it. We're getting a full push-pull from the EMR that we're integrated with. And we just wanted to show you a quick snapshot of what that would look like. This is in our Vitals Connect platform, where it's designed just to capture vitals for a patient and just push those vitals directly to the EMR to save time in vitals capture. I believe that's all that I had to talk about. I'm going to turn it back over to Zach. I do want to say thanks for joining us today. And I believe questions and answers will be soon. So if you have any questions, just put them in the chat or let us know. And back over to you, Zach.
Great. Thanks, John. See, I'm back unmuted. Great. I'm going to stop sharing there. We're going to bring this up again. And yeah, we are at the Q&A portion. So Carrie, I'm actually going to throw it back to you to see what questions that we can answer.
Sure. All right. And if you want to put up that slide with oh, there you go. Perfect. So everybody can see if you're interested in contacting your regional salesperson for additional information. Zach has put up everybody's contact. Of course, feel free to reach out to me directly as well if you need help with that. Okay, first question. I think this would be for you, John. Is it possible to create flags to sort the sessions by outside consultant and outside consultant specialty?
Right now, the sorting features are by users, so you can sort by users, but it's not going to necessarily flag in the system who's an external consultant versus an internal consultant. So most likely what you would want to do would be export that as a PDF, or excuse me, as an Excel file. And then from the Excel file, it'll be easier to sort in that way. It also offers a JSON file, which can have some custom reporting within.
Okay, thank you. Okay, so
I see in the chat someone asked how many users can join a session. It defaults to 2, but that number can be much higher. I don't think we necessarily have a cap on it. The important part to note about users in the session is currently the video call itself is a point-to-point, so it's only one user to one user, but everything else within a session can be seen by any number of users. So that you could have a specialist that's looking at the image captures, listening to the heart and lung sounds, etc., but they wouldn't be able to join the video conference.
okay. Also in the chat, it looks like, and again, some people putting in chat, some people in the question here. Could you delve a little bit more into the HL7 patient queries and the new authorization process?
The HL7 queries, basically we just fine-tuned what we had. They've been available for a while. What we've done for the most part is gotten a little more specific with the different fields that we can push back to the EMR. The authorization process is when a session connects to the cloud, and the way that the token is communicated back to the browser it's in a different hash than it was before. That is considered a little bit more secure. I don't have a lot of specifics on the exact HL7 interface. I'm not an interface engineer. I just know that we worked with a couple of customers that really wanted their information. They needed it to go into very specific fields within the EMRs, and we had to tag it a little bit differently. And so we refined some of the options that we had for the push to HL7 and across to an EMR.
Great. Okay, it looks like a customer is asking it. They said, I'm using AGNES Connect. Will my device be automatically updated? And I'm not sure if you're referring to if AGNES Connect platform will automatically be updated, or if you have an ultrasound device, if that would be updated for the streaming. And I think, John, you can answer. I know the device itself is specific to the streaming. So if you don't have an ultrasound device, obviously that would be something you can talk to your regional salesperson to add on to your current program. Do you want to answer that a little bit more, John?
Yeah, the AGNES Connect application that runs on the patient side does automatically receive a push update. We also send a notification out that an update is imminent and allows the customer to download first and go over a security check if they need to, and do the update themselves, or there's a time date that this is when the update will be pushed regardless. The ultrasounds, it's not going to automatically connect to an ultrasound after the update. There are some specific ultrasounds that we use that that we can pull into the system. It's not right now, we can't do every ultrasound on the market. If there is one that you use that that you're interested in us using, we can have a discussion about bringing that device in-house and testing and getting that stream going for that device. We do have a few that we've already integrated. It's not quite as uncomplicated as just getting a camera in, because there's other controls that take place on the ultrasound. So it does take just a little bit of work, but your regional sales directors can point you at the ultrasounds that we already do integrate with, including what Ken showed, which was a very easy to use USB probe that does a very good job for being a very compact device.
Actually goes well nicely with one of the other questions about medical devices. They're asking, of course, we showed the ultrasound probe, and they wanted to know what other types of medical devices AGNES Connect can integrate, or we have integrated, specifically whether it's our own and or what if they already have their own devices that they've purchased elsewhere and they want to integrate with this platform. Do you want to answer that, Zach? Or?
Yeah, I can answer that. So we have over 40 devices that we connect into. And without getting too much in the weeds on what we have, it's really any sort of primary care type of encounter, really nothing like invasive surgery or anything like that. Vitals, everything from just a pulse ox that we can throw on somebody's finger to a full vitals that takes blood pressure and temp and all the other information that we need. We've got cameras, multiple cameras from our 3-in-1 Versascope has attachments for otoscope, general imaging, and dermoscope. So that's 3-in-1, so it saves space on a telemedicine cart. We've got video only cameras, otoscope only cameras if there's something unique, ultrasounds. So really, I can't think of any other ones now, but that's kind of the tip of the iceberg there.
Great. Ophthalmoscopes, spirometers. We have a full list on our website too, but it could be up to 40. The most common ones, as Zach mentioned, is a core 5 or 6 devices that are most commonly used. But as long as it's USB driven, the data can be integrated. So whether or not we've qualified it with AGNES, and as John mentioned, we can, if you have a device that isn't ours that you want to integrate, we can go through a qualification process to see how it would stream. Then there's a question here, probably Zach, this is for you as well, about the pricing model. Is it by user, by number of consults, by organization? How is that priced? Is it?
Yeah, so the pricing for if we are so lucky to procure the hardware for you, so the carts and the medical devices, obviously that's that one-time fee. The AGNES Connect software itself, being a software as a service, is just as a single annual fee. We don't do per providers, we don't do per minutes, we don't do, hey, it's going to be this amount per month for pediatrics and then this amount a month for behavioral health. It's that single fee for access, unlimited access. We believe that when you do a limit like per providers or per videos, that really restricts, because you don't want to be thinking like, oh, if I add one more provider, I got to pay them more money. Here's access to the system. And if you need it for one nurse, great. You need it for 10. If you need it for behavioral health, and then you got to move to pediatrics, that to us again is what true scalability means. Is taking that single cart, that single access point, and just be able to use it without having to worry about upcharges or modulations or anything else.
Okay, great. And then was a question, I think John probably answered there, about for outside consultants, can they access AGNES Connect with an iPad or Android tablets?
So the answer is yes, as long as we have Chrome available on the iPad or Android device. I do like to caution about screen size. Some of the kind of older, smaller iPads, and iPads are kind of medium or large. Android tablets can get pretty small. Android devices can be pretty small. So we would generally recommend staying on a larger size screen or a desktop if you have it. But really on the far end, the biggest need is Chrome. So as long as there's Chrome available on the iPad or Android tablet, they should be good to go. Also, a reasonably new tablet. We don't want someone trying to do this on an iPad 1 because they'll have a bad experience. So, the general things that we would say with technology today: reasonably new, Chrome available on the most recent update, then we should be good to go. We've done that quite a bit. Emergency, somebody's out at the beach and they need to be reached, all they've got is their tablet. As long as we've got Chrome, we can make it happen.
Great. John, there's a question about setup and onboarding, and I know it may be not a short answer, but maybe just kind of walk us through a short summary of what that process is for onboarding and setup. What are people in for when they're looking to start?
So when we get started, when we onboard somebody, we will get basic information from them. We will, right in the beginning of the post-sale process, get some information about network needs, what ports we need, what whitelisting we need. We're getting away from ports with security where it's more whitelisted addresses. But we have a document that we share with IT so that they can get started on anything that they need to do. And then it's a basic gathering of information. What do you want your organization to be called within the AGNES scope? Do you have a logo that you want to use that we can upload? Basic user information so that we can get users started. It looks a little different if you're going to have on-site training, because some of that will be done during on-site training where we can get things added live. And then on the back end, our engineers spin up in our web hosting service, each client is delineated. They have their own space. So on the back end, our developers just add in that client space once we have the organization name. It's really a short process. It doesn't take very long to get done, and we can get new instances stood up very quickly.
And to add to that too, with the latest functionality of the administration controls on AGNES Connect compared to maybe how it was in the past, it's certainly a lot easier for a customer end user to manage the admin controls themselves. So even if it's set up and then they have to do additional things, it's a lot easier to do.
Yeah, and that there's a question in the chat that kind of touches on that about an external user that needs to come in. So you do have to have an account to log in. There's not a way to bring someone in that doesn't have an account, but that account can be created ad hoc in minutes. So if you have a new provider that you've never used before, but you need to bring them in for a consult, it is very easy to create them a user and get that user information to them so that you can have a third party come into the session. But all users that come in are authenticated. That's part of HIPAA compliance and HIPAA rules, that you have to be able to identify the users that come in, but then they also have to be authenticated, that it's not just an open platform. But with that control panel that we demonstrated, it's very easy to get a new user added.
Great. I think I don't see any more questions. I know we've addressed all the ones I saw in there, I believe, and then some. So thank you very much, John and Zach, for doing this presentation, and hopefully everybody learned something new. And if you're interested in more information, please feel free to reach out to us.